and I'll turn it over to Dr. Vito.
Thank you very much, Dr. Fernandez, for these words. I think that we can close this session and pass to the next, that is the another dimension, the fifth dimension that we identified. There is no policies without citizen engagement and participation, so I kindly and warmly invite our colleagues from COSMA to join the floor, and Paola Solventura, I'll give you the floor to introduce the fifth dimension, and please, the floor is yours.
So, hello everybody. Now we are in the last part of the conference, but it's very interesting, so enjoy it. One moment, because I need the next one. The next presentation, please. The next one. Chicas de técnicas, la siguiente presentación, por favor. La que dice Paula Solventura. Yes. So, to kick off this session, I would like with you this video.
What if the best for health and the economy is a healthy planet? It is not an option. It is a necessity. I am doing my part, but one cannot generate change alone. If you want to join, you can do it now.
So, my name is Paula Solventura. I am pediatric endocrinologist, and I work here in Barcelona in the Hospital Germán Trias y Pujol and in East Global. How do you know environmental health is not a new concept, it's an old concept, and this concept was evolution, and now for this we are talking about One Health today. In our planet, is now expecting a crisis due to the impact of the natural system and research caused by the human habits. But this impact is also, this also impact in our health. It's important to know what the factor risks are impacted in our health, because for the doctor, this information can help us to know what people sick or ill and what people know. This is so important that different organizations is studying what happened with this factor, and now we know that the 25% of the global burden of disease and mortality is attributed to this exposure. The exposure and this consequence depend on different factors like age, gender, and place of residence. but living here in Europe, for example, don't accept us to this risk. And now the problem is that there are determined risks that increasing, for example, non-communicable disease. Inside of this disease, there are mental, behavior, and neurological disorders that you know is increases in the time. Now the objective of this session is to know what are happening with this point. Today we are talking about eco-anxiety, and for this we will see this project in different moments. In the first moment, Jordi Serrano, that do you know, will present the platform that you use to the study that Marina Romeo will present the result. The result is about the study, eco-anxiety study, and follow with that, we explore the topic eco-anxiety and emotion in the panel moderated by Karen Beilenger. Later, we examine how this emotion can be transformed in positive action in the session led by Irene Baños. And finally, Professor Fernando Valladares will close the session. So, for start this session, Jordi Serrano speak about the platform that we do or what you use for do the result of the study.
Thank you, Paula. Thank you very much for your super energy. Governments, you see how much spending in prevention governments are doing. Only 0.2% of the healthcare budget. It's not even 0.2% of the GDP. It's 0.2% of the healthcare budget. And if you spend only that, it makes that your system, this is a OCDE average of the spending of the GDP percentage in the healthcare system. So if you spend only 0.2 in prevention, you spend on average 10% of GDP. You know, there's countries like the States, they spend 18% of the GDP in healthcare, and they're not very efficient, and other countries spend less. If you spend 1.1 if you would spend 1.1 on prevention, the average dropping of spending would be 4 points. 4 points of GDP, okay? Now they're asking 2 points to enter NATO. No, sorry, that the countries spend 2 points of GDP every year, okay? So imagine how much it could be done in that sense. This is the important key. Governments do not have money, and this is a little bit of many years experience working with governments and so on in different platforms with our mother house, Universal Doctor, but we created this company, UDA, to work with different NGOs, municipalities, companies, governments in a transversal way to offer them a prevention data collection tool, intervention tool, which basically works in two fronts. One, to make clinical studies. Some of you know REDCap, it's a clinical study, but we have already prepared templates and so on, and interventions. And it's so easy that the interventions to reduce cardiovascular risk or to reduce other things are already prepared to be implemented, and basically to generate automated reports, and most importantly, because all that can be done, but the concept, the objective, is to basically propose governments to have value-based care tools. Governments right now do not have much money, still after COVID some money, but there will be a time in 2-3 years that they will have no capacity to pay what they're paying. And basically we'll have to start working by outcomes, for outcomes, which is value-based care. We don't pay you by the number of visits that you have in the hospital, but we pay you for how much outcomes do you have. And this is quite complicated. But if we do it well, we can mix for One Health, planetary health objectives. Less visits, physical visits with the car to the doctor, more telemedicine, more remote monitoring, diminution, okay, of the spending on the healthcare, okay, and many things that will reduce greenhouse emissions in hospitals and so on. So this is value-based care and planetary health. The packages, sedentarism, corporate health, healthy aging, we are, as I explained yesterday, interventions in forests and so on. And this is one of these packages was done to do the study, And basically, can you see here different types of studies? The study that we're talking here, okay, that our colleagues now will explain. It has been done with a platform, and we see ourselves as the platform of the social determinants of health. Okay, tomorrow morning we'll be in Valle Verón Hospital working with a minority disease collection of patients. So minority disease, One Health, okay, all types of different perception, long COVID, all these diseases, all these things have to do with social determinants of health. We are there with the platform prepared to be used. And thank you very much. It's always a pleasure to work with the people of COSMA. Here we have Dr. Joy Mahia, Felipe, Dr. Joma from DigiMevo. We had before, of course, I don't see now Carole that promoted also initially all that. Well, all the people here from we work together from COSMA, and it's been a pleasure to collaborate with Domenico, and in this conference. And thank you very much. Thank you to you all, and congratulations to be here Friday afternoon at this time. Fantastic, fantastic.
So, thank you. And now Marina Romeo will present the result of eco-anxiety study done in recent months. Marina Romeo is full professor psychology in the University of Barcelona and holds the role of local coordinator in the master program. Additionally, Marina Romeo is director in Cátedra University of Barcelona in ADECO. ADECO is the Foundation for the Integration of Workforce of Persons with Disability. Her excellent contribution to her file have earned her recognition and includes Alerts Awards. Welcome, Marina, and welcome all the group of Marina.
Thank you very much. Well, in the way that my antecessors are talking before, thank you for coming here in Friday afternoon in a sunny day in Barcelona. Well, my presentation is related, as Paola said, and thank you to Paola for inviting me and for to be part of this project in the research project. Thank you very much. And I will present the main results related to the eco-anxiety. And my structure of my presentation is in this way. First of all, I talk with a theoretical framework that we are talking before, the main objective, the main results, and the main conclusion. Well, as you know, the climate, the effects of the climate change in different ways related to air pollution or the rising sea are affecting in three main areas: physical health, mental health, and the community health. But it's true that in this last year, one of the topics more focused, more interest for the researchers is related to the eco-anxiety in the way that previous researchers are talking about. But my main area is the psychology is in this way, the definition that I focus is the APA definition, is the American Psychology Association that is talking about the eco-anxiety is a chronic fear of experiences and environmental catastrophe. And I thought that is interesting. I put in this slide this reference in the Journal of Climate Change and Health in the way of somebody are interested in this specific topic. That is an article, a systematic scoping review about this topic that I thought that could be interesting to focus, and more focus in this way. This term, eco-anxiety, the main aspect is the anxiety, and when we talk about the anxiety, we are talking about a disorder, a personal disorder, and a disorder that are characterized by the excessive and constant worry, a dissociated mood, and in the way that the mood that the subjects are not connected with the relation that are they living. Well, a prolonged situation, we talk about this prolonged situation, we are talking at least 6 months. Somatization, a lack of concentration. And we distinguish two kinds of anxiety, the trait anxiety, understood that the characterization of personality, and the state anxiety, that is in the way that we are talking with the eco-anxiety, that is an anxiety that is structured in a specific context. when we talk of the authors are talking about this kind of eco-anxiety, they distinguish three kinds of emotions connected with them. They are talking about the fear, about the impact that the future generation that they will live, the anger that the before generation not making sufficient about that, and the exhaustion in the sense that I don't have the sufficient resources to change this situation. Who are the three main targets at the literature, the scientific literature are structured that are the more facilitated develop this kind of eco-anxiety? On one way, the scientifics. They evidence that the people that are more conscious about the problem have more possibilities to develop this kind the disorder. Another way, the people that are living close with these spaces that are affecting, in this way, the indigenous, rural residents, farmers, because they are seeing in their common life what are the changes in the environmental. And the third is the young people, in the sense that the presentation before, the millennials. And in this sense, I put here two references, one of the Journal of Environmental Psychology and the other from the Frontiers, that are analyzing the eco-anxiety in children in the fear and the future. But I would like to focus on one research specific. In 10 years, in 10 countries, this study in 2021 published that they analyzing in 10,000 children and young from these 10 countries: Australia, Brazil, Finland, France, India, Nigeria, Philippines, Portugal, UK, and United States. This fear about their worries about the climate change. It's interesting because if you see in the results, the children from the India and Philippines are the worriest about what is happening about this climate change. Another side, United States is not so much with this kind of sense. 59% is very extremely worried, and more than 15% feels emotions like sad, anxious, angry, powerless, and guilty. Wow, the situation is not so good. With these results, we thought, we are talking and said, well, what is happening in Spain? And in this way, we are in this preliminary part of our study that and analyzing what is the level of eco-anxiety that are in the Spanish population, in order to understand better their level toward the environmental. We developed a cross-sectional cohort. We administrated a questionnaire in an online platform. And the instrument that we administrate to the differences to our colleague that analyzed in a qualitative sense, we decided to analyze in a quantitative sense using with the administration of this questionnaire that is a validated questionnaire developed by Clayton in 2020 that is structured in 4 dimensions, the analysis of eco-anxiety. They analyze the cognitive and emotional impairment in order to know how is that dysfunction related to the emotional and the aspects more cognitive. The functional impairments understood as in which sense are affecting the climate change in the personal life and in the work life. Experience understood that in which sense the subject are perceiving changes in her own or in the colleagues or the environment are more close to the people. And behavioral engagement related to the commitment that the subjects have in related to promote the well-being to the environmental. Our results, as you see, is not so much. We are in a preliminary research collecting data. We have only 234 persons that answered our questionnaire, mostly women from the urban area, bachelor's degree, and the work activity mostly is the health sector. All the other sociodemographic data, our interest is with more data to try to analyze two profiles, if it's possible to analyze and to see profiles about this eco-anxiety. Our main results show that, in general, as you see in the means and the standard deviation, are that people not have so much cognitive, emotional impairment and functional impairment, and are developing a lot of behavioral conduct related to the environmental sense, but they experience a climate change in her own environment. Analyzing more close this kind of results, we saw that in the first dimension related to cognitive and emotional impairment, 50% feels that thinking about climate change makes it hard for him or her to concentrate. It's the only in this the eye is the only item that in this dimension that is affecting in this part. Related to functional impairment, we saw that are two items in this dimension that are affecting in the 15 more or less of the subjects that I answered. They feel that have trouble finding a balance between their concern for sustainability and the needs of their families, and feels that their friends tell her or he that he thinks too much about the climate change. The more important results in this way is that the majority of the persons feels that the experience of the climate change is clear. They have directly affected by the climate change, as you see, the 50%, or know someone who has been directly affected, or have noticed changes in a place important for them. Related to behavioral engagement, the two main conducts that the subject developed is related to recycle and the turn of the lights. With the data that we have, we only find differences between gender, and the differences significant are in cognitive emotional impairment. The women feels more cognitive emotional impairment than the men's, and they recycle more than men's. Differences significant. Conclusion, in this way, with this small sample, is that women tend to perceive higher cognitive emotion in the way that I'm saying, and they are developing more recycling behaviors. In the perception of regarding the impact of climate change on their life is really notable in men and women. That is our QR. If you are interested, we appreciate so much that if you answer our questionnaire, because we are trying to collect more data in order to know more about this process. Thank you so much.
So now we connected with this study, we will explore the topic of eco-anxiety and emotions in the panel moderated by Carol, that is the first woman there. So Carol is working for more than 25 years in the field of psychology too. In recent years, and after completing a master's degree focused in emotion and several courses on climate change and sharing, she specialized in the area of climate emotion and eco-anxiety. She has managed social innovation projects in this area of education and professional insertion, supporting empowerment and health conditions, promoting equality, and transforming the local economy. So thank you, group. And she introduced all the group.
Yes. Good afternoon. In this session, sorry. Thank you. Good afternoon. Now, yes. In this session, está encendido. Está on. It's on, right? In this session, we will emphasize the consequences of climate crisis on psychological health. After our college, Marina has presented us with a study that carried out, We will try to contribute more elements to the debate. But first, I'm going to introduce my people who's here. First, Mr. Felipe Miralles is a computer science engineer, holds a Master of Science in Information System by New Jersey Institute of Technology, and in his PhD in Engineering and Advanced Technologies by Universitat de Barcelona. He's an entrepreneur, professor, and principal investigator in international digital health R&D initiatives, right? And he is also the executive director of health technologies at EURECAT Technology Center in Barcelona. Okay. Next, we have here Ms. Maria Lledó, is an interior designer, has received several awards for her project La Fourmilière, okay, a collaborative housing concept designed for achievement of happiness. These are healthy spaces for young individuals with functional diversity. She specializes in accessibility and universal design. She completed her training in affective ecologies and is continuing her education in neuroarchitecture. Okay. Then now I would like to introduce you Dr. Panisello, Joima Panisello, graduate and doctorate in medicine and surgery at the University of Barcelona. She specializes in internal medicine, developing her clinical and research activity in the field of nutrition, lipids, and arteriosclerosis. She works as a university teacher, and she has directed 2 national plans, training, courses on chronic disease, etc., etc., etc. Okay? And last but not least, we had Dr. Jordi Serrano. Dr. Jordi Serrano is a family doctor, is the CEO of Universal Doctor, a company linked to the field of global and digital health for more than 10 years, with project and implementation in various countries and international organizations like WHO and UNAIDS. Okay, start. To begin with, I would like to comment as colleagues Julie Sousa and Melissa Jimenez were saying this morning, eco-anxiety is a broad umbrella of emotions, and which we use to refer to anxiety related to climate change. And the study, as Marina presented right now, the emotions that this study has revealed have been fear, frustration, anger, sadness, hope, worry. Do you agree, Dr. Jordi, that this emotion describe like what you have encountered in your personal or professional practice? Yeah. First.
Thank you very much, and congratulations to Marina. And she's right, we have only these preliminary outcomes, but there was the Spanish version, there was also a parallel version in English, there were also a bigger number of, but we encourage everybody to keep answering, and in that sense, I think we can reach 1,000 people soon between the both, and thank you very much for the big work. And of course, I am very involved in different projects, especially with young people, which are the best in that sense, and yeah, of course, this can be a biased opinion, but in general, the people we are working with in these type of projects, they have a kind of anxiety. And if I had to choose between all these symptoms that you were mentioning, in some cases rage, which is not a positive outcome, it's impressive sometimes. And I wanted to highlight what we hear before this morning, from eco-anxiety to eco-hope, no, from a colleague. And yeah, here in front. Thank you very much for this sentence. I think we should try to to foster that initiative from doing, no? Because only the way we can solve that by doing, and in that sense, I would be positive to really make all the young generation participate, work together, and work together. And the 3 target groups that was mentioned, Marina, scientific themselves, because they don't know how to convince others. They have been working in this explanational way, and nobody is doing things by explaining things in that negative, staggered way, and the people in contact with nature and young people. No? So I think let's be positive and help them in that sense.
Maria?
Yes, thank you. You listen me? No. Okay. Yes, I see it especially in people with more vulnerable health conditions because this environment changes directly impact on their physical health. I believe it is also important to talk about emotions. For example, when hopelessness can blind us and make our daily lives difficult and filled with sadness, as can happen with chronic illnesses. We live in a society with a lot of depression and anxiety, as we know, and I think it's essential to mention it. However, from my point of view, there is always hope. We need to find and share those specific aspects that give answer to our fears, no? Those that make us feel like we are contributing to the care of our planet and therefore of humanity.
Wow. These are very interesting answers that could be further explored, but I would like to discuss more deeply to threat posed by climate change, given the complexity of uncertainty of the issue, of the problem. Medicine, Dr. Panicero, is increasingly finding more links between emotion, stress levels, and health problems. Could you explain this relationship?
Wow, that is not an easy subject, and in fact,
Summarize.
Yes, I am going to try to doing it. That is really a complex subject to discuss in a very short period like we have today. But let me tell you some key important things. First of all, stress is a fight or flight situation, but when does it occur? Stress occurs when emotionally or physically or mentally demands increase beyond the regulatory capacity of our body, or our organism. And look at this, when you feel a situation as a threat, and I am saying feel, because it's a perceived stress, it's a perceived threat, maybe cannot, it's a threat, yeah. But I am perceiving stress, I am perceiving that means emotion. And at that time, our hypothalamus activates an alarm system in our body. And that alarm system is really complex. It's a through combination between hormones and between neurons answers. And finally, you are producing adrenaline, other hormones, stress hormones, cortisol. And maybe you are wondering yourself, where does it happen? Does it happen in an axis? HPA is the hypothalamic pituitary adrenal, and that is a really complex axis. It's a major neuroendocrine system that is activated in answer, in response to stress, and has been shown that to initiate this stress response. And of course, here in the hypothalamus, in fact, in the paraventricular nucleus is the same, doesn't matter. CRF, which means corticotropin releasing factor, is produced in that place and acts on the anterior pituitary, and at that place synthesizes or creates ACTH, adrenocorticotropic hormone. Okay, and that produce in adrenal cortex glucocorticoids, and that they are workers, they are effectors, they are producing, acting on this age, and produces a lot of physiological changes, a lot, in response, in answer to that stress. Of course, while this acute stress is short, this answer is adaptive. This is perfect. But if this stress is long, it's longer than it should be, this chronic stress can cause dysregulation of this axis. And of course, when these glucocorticoid levels are there, of course, the glucocorticoids, adrenaline, your heart rate is going up, your blood pressure is going up, everything is going up. But corticoids go through the brain, go through the blood-brain barrier, and they act on receptors. They act and regulate genes involved in neurogenesis, involved in neuroplasticity, in neurotransmission on PFC, prefrontal cortex. Prefrontal cortex, where I am deciding, wait a moment, pros and cons. And after that, I am going to do that. After, lower amygdala. Go action, take action, limbic, okay. And in that way, chronic stress produces that elevation of cortisol and adrenaline and other hormones, and is going to produce a lot of things. It's going to produce increase in your glucose level. It's going to produce more pathologies, like obesity, diabetes mellitus, metabolic syndrome, heart attack, even a stroke, even cancer, breast cancer, colon cancer, impaired cognition, memory, etc., depression, etc. And in that way, that doesn't work for us properly. But what happened in certain periods? What happened in adolescence? We were talking about eco-anxiety, adolescence. But what happened in that period of time? In that period of time, stress, the chronic stress, is more dangerous. And it's more dangerous because at that time we have a brain with a lot of plasticity, but we have here the limbic. Limbic is strongest. And here, the prefrontal cortex. That grow up very, very slower, maybe. Well, okay, no comment at all. Okay. And at that time, you need that period can be without stress, without chronic stress. Because if we put eco-anxiety, if we put environmental, this kind of substance, we are going to change the communication, we are going to change how this part is going to mature, and everything after that is going to change. Every single thing. Our white issue in the brain, gray and white substance in our brain, the nucleus, the circuits, etc. And it's really, really important.
Then I ask myself, I will ask you, given the scientific evidence we have the impact of climate change on health, is this feeling appropriate to the situation we are experiencing?
Good point. I think that, of course, many people say, okay, we need anxiety because otherwise we are not going to do anything at all. I disagree. I think that we need this point of initial eco-anxiety must be used only as a trigger to begin the action, to
Then,
go the action.
If I understood, I try to repeat your idea correctly. The climate change can trigger positive stress.
Yes.
In which anxiety can be understood like an alert system.
Yes.
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 That leads to search for innovative response, right? To
Right.
overcome the stress, to overcome the worry
Yes.
about,
Yes.
or in a positive way,
Taking
it might
action.
trigger negative stress.
Of course. That
That is.
is what it is.
Okay. Thank you.
Thank you.
So.